Hi everyone. This afternoon it's getting a little late, but I'm here as I promised I would have been here. I definitely told myself I have to be more consistent. So I'm here this evening and I'm here to share with you some key points on breastfeeding. I'm sure I'll have to do some more episodes on this because we have a different audience. Apart from my young nurses who are being transferred to those different areas, maternal child, the postpartum, labor and delivery, and the NICU areas, they are learning new concepts. They're learning different things about the newborn in the maternal area. And so some of the things that we've started skin to skin right as soon as that baby, within that first hour, that baby is born, that baby is placed on mom. And that baby naturally gravitates to the breast. It's amazing to see what happens when that baby is born. And you can identify with that, and you know that too. It's really interesting. That baby just start moving towards the breast once the baby is placed to the we are wonderfully made, right? There's some things we don't understand and we're not as finite beings, but there's some things that just, wow, you have to say we are fearfully and wonderfully made. And we are our entire being, the mind, the body, the soul, the spirit, so this physical, the spiritual, different dimensions. Just think about it that way. So today you want to know who I am. I'm Dr. Miriam Smith, the host for empowering new nurses in delivery of high quality care to all patients. I'm the nurse. I'm a mentor, nurse educator, and mentor. And I'm one of those who advocate. I advocate for nurses. I advocate for my patients. I advocate that all patients deserve the best high quality care. Excellent. I believe in each patient receiving the best care, evidence-based, proven, effective, high quality. And so today, one of the areas that I worked before I retired was in the maternal area. And so working as an educator, I've learned a lot, I've seen a lot, and I've spoken to different nurses in different areas of the maternal area. And also I'm certified in as a lactation counselor. I've seen some of you before. I've seen some of you before, and I know we all make sure we try to make sure we have our renew our certification that we can be even more current and be able to help more mothers as they adjust in that phase of their lives. So today I'll talk a little on breastfeeding and why it's so important. I think I'll be doing a few episodes on this because it's important. We have some young mothers and they're asking questions. We have some grandmas and some of them are instilling some of their, let me say, long time way of breastfeeding. And sometimes we have to make adjustment as we learn current and as we improve and advance. So we give credit to those who have done their part. For example, my mom might have fed me a certain way, but as we advance, we know there are new ways and we explore them and we encourage our young mothers to do that also. Of course, with some help because it can be challenging sometimes. So it's not just breeze over. Some babies take a longer time to latch, and there are certain techniques that need to be implemented in order to be effective to ensure that the baby is getting the milk. Okay, so a little about breastfeeding. Breastfeeding is more than the milk. It's a lifelong investment. I'm going to read this statement that I have here. Breastfeeding is not just about feeding a baby. It's about laying a foundation for health, bonding, and emotional security that lasts a lifetime. Breastfeeding with a purpose, nourishing the body, strengthening the bond. Every moment a mother breastfeeds, she's doing more than nourishing a body. She's building trust, connection, and resilience in her child. You have seen mothers on the unit struggling sometimes. Some of them they're just about ready to give up because the baby is not latching and the baby seems very upset. But a little perseverance, a little help from whom? From the nurse, lactation counselor, the lactation consultant. There are so many different techniques that can be implemented to help that mom who is anxious, who might be feeling so frustrated, doesn't feel like she wants to continue the process, which can be tedious sometimes. But perfect perseverance, you would say practice makes progress. Someone reminded me, at perfect, it's progress. So breastfeeding matters, a gift that keeps giving. Breastfeeding is one of the first and most impactful gifts a mother gives. Yes, supporting a baby's health today and helping the baby for the future, the well-being for the future. So, my friends, just remember, strong mothers, strong babies, the importance of breastfeeding is so important. It benefits both mom and baby. And so I will be coming in. I'll be coming back to discuss and share with you some of the benefits apart from bonding for the baby, the immunity, and the list goes on. Even the research has shown the IQ of the babies who are breastfed is higher, tends to be higher. So you want that. And of course, mom, it helps mom. So we're going to be going through the benefits for mom and the benefits for baby as we go in another episode, why it's important. And I just want to zero in on this, that there are moms who, because of certain medical condition, they are not able to, or the baby's medical condition, they're not able to breastfeed. So you're encouraged to do the best you can with alternatives. So please understand that, and we're not putting you down. You have your part to play just the same. Thank you so much for listening. And I know my young nurses, they're learning that. Those who have not yet gleaned all of what it is to know about the mom and teaching them and the anxiety, and dads too, because they are part of the team to ensure that the baby gets the milk, so to ensure that the baby is getting, and the hygienic area of that also to ensure that it is clean. The nursing consultant, the nursing counselor will also share all of those areas with you to ensure that the baby is not sick, doesn't get sick because of lack of not being prepared well. So the preparation is so important. And if you look on my screen, you'll see sometimes the timing for certain how long it can stay out, how long it can be frozen, and so forth. It's all in my chart. You just have to check back. But definitely, I'll be coming back on the benefits of breastfeeding for both mom and babies. Thank you so much for listening, and share this. Share this with mothers. Share this with some new moms. and we can all research it too. All right. So thank you so much for listening and take care. You can connect with me on YouTube at Miriam Amanda Smith. Yes, you can connect with me on Podcastmare, that's Instagram, podcast Empowering New Nurses. And so on my website, Empowering New Nurses. So there are many platforms which you can connect with me. And of course, one of my most recent book will be coming out this first quarter of 2026. That's Empowered by Grace. And that's a spiritual uh, booklet with nuggets because I know for sure from my personal experience, uh, nurses can become overwhelmed at times. Workload, shortage, environment. Oh, there's so many factors that can contribute to a nurse feeling uncomfortable and overwhelmed in different areas. So it's just like, health is not just has to do with the physical, but we think of the dimension of the emotional, the spiritual, the physical, the spiritual, the emotional, the psychological. And so many times the spiritual can be neglected and one might become so broken and discouraged that they might want to quit nursing. But from my personal experience, I know for sure that there are times I had that experience, but I relied on the Lord and He has brought me through. And if He had done that for me, I'm sure He'd do it for you. So when you feel like you want to quit nursing or you want to give up, think again and rest in the Lord and ask Him to help you, because He will. He helped me. He'll do the same for you. Have a blessed evening. Look forward to seeing you again. Share, subscribe. Just hit that button and subscribe. I'll do appreciate it. Be blessed.